How do you follow up on an abnormal breast cancer screening? When a screening like a mammogram shows an abnormal result, it can feel confusing or worrying. But understanding the next steps helps clarify what's happening and what actions are needed. The follow-up process depends on the specific findings and how the radiologist categorizes the results using the Breast Imaging Reporting and Data System, or BI-RADS. This system helps guide doctors on what to do next. If the mammogram is labeled BI-RADS 0, it means the images are inconclusive. In this case, your healthcare provider will recommend immediate additional imaging, such as diagnostic mammography with extra views or a breast ultrasound. These tests help clarify what the abnormality might be. If the BI-RADS category is for a 5, it indicates a suspicious or highly likely chance of cancer. These results requiring prompt action, usually a biopsy, to get tissue samples for diagnosis. Follow-up imaging can include diagnostic mammography, ultrasound, or even magnetic resonance imaging if needed. The goal is to gather more information about the abnormal area. When a biopsy is necessary, there are different types, including fine needle aspiration, core needle biopsy, or surgical biopsy. The choice depends on the size, location, and characteristics of the abnormality. Timing is very important. Research shows that most women receive follow-up within about 13 days after an abnormal screening. Ideally, follow-up should happen within a few weeks and no later than 90 days. Delays can sometimes lead to later diagnosis, which might affect treatment options and outcomes. Healthcare systems work hard to ensure follow-up occurs quickly, often within 30 days. Several factors can influence how fast follow-up happens. Patient factors like age, symptoms, insurance, and prior screening history can play a role. System factors such as communication between providers, appointment availability, and active tracking programs also matter. Clear communication about what an abnormal result means and why follow-up is necessary helps reduce anxiety and encourages patients to stay engaged with their care. It's important to remember that an abnormal screening does not automatically mean cancer. Many abnormalities turn out to be benign or non-cancerous. For women at higher risk, such as those with BRCA gene mutations or a strong family history, additional imaging like breast magnetic resonance imaging may be part of the follow-up process. Sometimes, a clinical breast exam is also performed, especially if there are symptoms or high risk factors, but its role in average-risk women without symptoms is less clear. In summary, following up on an abnormal breast screening involves quick, targeted steps, additional imaging for unclear results, and biopsy for suspicious findings. The aim is to diagnose early and accurately, which can improve treatment success. Prompt action within days or weeks is key. Good communication, patient education, and healthcare system support help ensure timely care. Always consult with healthcare professionals for personalized advice, as each person's situation is unique.